تمام. السلام عليكم. طبعا هذا this is a shoulder examination session. As usual, whenever you start to examine any part of the body, you have to start with the certain parts or certain scheme that you should follow all the time. So usually you will find the doorway information about your patient. They will not ask you for full examination of the shoulder like now. We're doing full examination of the shoulder just to show the process of examination. But usually they would ask you to examine certain parts of the shoulder, only not to examine all the shoulder. So first of all, as usual, you will read the doorway information. You would either ask you to examine for instability or for rotator cuff or for impingement. He will not ask you again to examine all the shoulder. So start by looking the door. Introduce yourself. السلام عليكم. اهلين استاذ محمد، انا دكتور عصام ممتحن الدور. هل ممكن تسمح لي اني نفحص كتفك؟ تفضل. تمام. بعد اذنك ممكن تشيل بس القميص والأندر وير بس من بيكون كتفك مفتوح. تمام. I go to wash my hands. تمام. من بعد اذنك استاذ محمد ممكن توقف وتقابلني. I'll start my examination first by full inspection of the patient. So I will ask the patient ممكن تحط يدك في الوضعية هذه to be in the anatomical position. So I've looked to the both shoulders. So I can see that the left shoulder is a bit higher than the right one. Getting closer, I can't see any scars or any deformities. I can't see any wasting or specific wasting of the muscles when looking at the shoulder from the anterior part. Then it's better if you have good room in the space of the room. You can't just rotate around your patient. If the room is very narrow, you can ask him, please, ممكن تلف على جنبك. So looking from the side, I can see good shape and contour of the deltoid. I can't see any wasting, any scars, any abnormal hair distributions or any significant deformity. ممكن بعد نلف الجهة الثانية لو سمحت. Again, looking at the back of the patient, so I can't see any scars, any deformities. I can see supra and infra spinous fossae. They are well filled. I can't see any wasting or atrophy. I can see a good contour of the cervical spine and the spine. I wouldn't appreciate any deformity. Again, I can still say that not both shoulders are not at the same level, with the left shoulder is a bit lower than the higher shoulder. Since I am here, looking at the patient from the back, so I would ask the patient ممكن من بعد إذنك أستاذ محمد، تمام؟ نبيك تدير الحركة هذه لما نقول لك، تمام؟ بس لما نقول لك ديرها، ممكن تلف ايدك زي ما قلت لك إلى فوق، تمام؟ Now, since I'm here in the back, I would look at the scapular dyskinesia. So أترجم زي ما كنت. So both scapulae move symmetrically when the patient raises his arms up. ممكن ترفع الجهة الثانية. Again, looking at the right shoulder from this side, same finding. I couldn't see any scars, any deformities. The deltoid looks in the good contour. ممكن تلفت لي مرة ثانية، ترفع ايدك مرة ثانية. I wouldn't really forget to look at the axillae, both axillae for any scars or any abnormal contours. I just finished up with my inspection. ممكن ترتاح، تمام؟ اسمح لي بعد انك حنلمس الكتف بتاعك، لو كان في اي مكان في الم او في وجع وقفني قول لي بس ان هذا المكان وجع، تمام؟ I would warm up my hands, then I would look at the patient's face. I would start systematically from the sternoclavicular joint. I would palpate the clavicle, acromioclavicular joint, acromion, spine of the scapula, medial border of the scapula, lower border of the scapula, tamam, deltoid, lateral border of the acromion, coracoid process, okay, tamam. Then I will feel the anterior axillary fold and posterior axillary fold and the contour of the deltoid, okay. Then I'll just follow the supraspinous fossa and the infraspinous fossa, and I couldn't appreciate any pain while touching the patient. So now I'll move immediately to the move. So for the movement, I'll ask the patient بعد إذنك أستاذ محمد بدك تدير الحركات اللي بقول لك عليها. أول شيء بدك ترفع إيدك بالوضعية هذه، جيبها فوق على شيء. So patient can go forward deflection from 0 to almost 140 degrees, estimated for 140 to 160 degrees. Don't give very sharp number. طيب. بعد إنك تاخذ إيدك بالوضعية هذه، جيبها. and he can abduct to almost 90 degrees. بعدين نحط ايدك جنبك بالوضعية هذه. طلع ايدك لبرا. And he can do external rotation up to 45 and to 60 degrees. While I'm here, I could examine for the infraspinatus, looking for external rotation like this, and it's negative. تمام؟ ممكن تطلع ايدك داخل ايدك الداخل. He can do internal rotation up to 80 degrees. Since I'm here, ممكن تاخذ كوعك لقدام, and I will push, examining for subscapularis. And both are with the same or same bowel. After that, I want ممكن تاخذ ايدك بالوضعية هذه. تمام؟ ايه ترفع تطلع ايدك من الخلف هيك. Looking for external rotation at abduction. He can get up to 90 degrees. And negative for Hornblower test. So I examined for teres minor as well. ممكن تنزل ايدك تحت, and he can do internal rotation up to 80 degrees while the shoulders are on abduction. Okay, last examination for the movement. ممكن بيك تاخذ ايدك ترفعها اقصى شيء توصل in the back. Since the patient is here, ممكن بيك تاخذ ايدك تدفع and تدفع ايدي برا. I'm examining for the subscapularis again. تمام. I'm done with the movement. In case the patient has any limitations of movement, I complete that limitation with passive movement, looking for any restrictions of passive motion. Now, I'm done with the examination for the movement. Then I will go to the special test. So for the shoulder, we have certain special tests. We have special tests for the impingement, special tests for the biceps tendon, special tests for the AC joint, special tests for the rotator cuffs, and special tests for instability. Okay, starting simply, usually with the rotator cuffs, so you don't forget them. So first of all, I will examine for the supraspinatus. ممكن بعد ذلك تاخذ ايدك بالوضعية هذه. تمام. Doing the internal rotation of both shoulders, we're doing what we call Jobs test. بعد ذلك ممكن ترفع ايدك فوق أستاذ محمد. Okay, examining and comparing the power of both muscles. So Jobs test is negative here in this patient. I've examined for the subscapularis with breast plate test earlier and lift-off test. That was done. I will not repeat them. Then I will examine for the infraspinatus. I examined by the external rotation lag test, and that was done during the movement. Hornblower test was done for the teres minor test, teres minor muscle. So I completed the rotator cuff examination already. Then I will move for, since I'm examining the muscle, in order not to forget, I would complete my examination by examining for the biceps tendon. So for the biceps tendon, I have two tests. I have speed and Yerkes test. So speed test, I have to look at the patients. I have to put my hand in the bicipital groove, looking for the patient. Do you have any pain? No. Tamam. While your hand is here, extended, elbow extended, I want you to lift up your hand. Okay? Looking at the patient, ارفع ايدك فوق. في أي ألم? No pain. This is negative for speed test. Then for Yerkes test, نبيك بعد انك تاخذ ايدك الوضعية هذه زي ما انا مداير لو سمحت. نبيك تفتح ايدك لبرا. Okay? لما نقول لك بس. تمام؟ I'm putting my hand on the bicipital groove again, and resisted supination. This is negative Yerkes test. Okay? Since I'm examining the biceps, I would go into the labrum. For the labrum, I would examine for من بعد إذنك O'Brien test. So for the O'Brien test, I would do forward deflection, adduction, and internal rotation, and look at the patient face. ممكن ترفع ايدك فوق. في أي ألم. This is positive O'Brien test for superior labrum. Then I would take external rotation. ممكن ترفع ايدك فوق. في أي ألم. This is examination for AC joint. تمام. Since I'm here, I'm examining the AC joint. I would do scarf test at the same moment with complete adduction of the shoulder and looking at the patient face. Any pain? يوجع. ما فيش وجع. تمام. Since I'm here, I would complete my examination of doing impingement test. So I would do internal rotation while the patient is completely adducted. يوجع هيك. Then I would do some adduction. يوجع هيك. هيك يوجع. تمام. This is negative Hawkins test for impingement syndrome. So I'm done now with the rotator cuff, with the biceps, with the AC joint, with impingement syndrome. Okay? Now I will complete my examination by doing examination of the instability. For the instability, first test that you need to do for instability, sulcus test. So look at the patient, take his arm like that, draw it down, and feel how much inferior translation it goes. Okay? And measure it, and compare it to the other side. Tamam? This is negative sulcus test for Dr. Muhammad. Then you can do lift and load and shift test. So the load and shift test, the idea you need to know or estimate how many anterior and posterior translation of the shoulder is going on. So you hold the shoulder, you put your hands on the acromion, you hold the arm like that, look at the patient face, and translate the shoulder anteriorly and posteriorly with some bull. Again, you can do that here and compare both sides. Okay? Then you would examine for the anterior dislocation. So for the anterior dislocation, it's very important that you do it while the patient is relaxed. The best place or the best way to do it while the patient is supine. But again, you can you do it with the patient while the patient is sitting. I advise you not to do the apprehension test while the patient is standing up, because it will be difficult for you to monitor for the patient, and he will be in very high position. So you do abduction and external rotation, and look at the patient's face, okay? So he's not apprehending, okay? So this is negative apprehension test. Then, if the patient is having some apprehension, then you can do the relocation test. So in the relocation test, you do the same apprehension, but you put your hand in front of the glenoid and look at the patient's face, and he will not be apprehending, okay? This is for the anterior instability. For the posterior instability, you can do Kim and jerk test. So for the Kim test, it's again, you put your hand on the shoulder in abduction, you apply axial load and inferior shift and pass it posterior like that. And look if the patient has any pain or apprehension. For the jerk test, again, it's the same load, but you do adduction and anterior rotation, and you load it posteriorly against your hand. And the patient will develop pain in case he has any positive posterior labral injuries. At the end of the examination, don't forget to do a Python score for the patients. بعد النكسة محمد اللي بيكمل الكوعين كاملات. Looking for any hyperlaxity. This is 1. This is 2, hyperextension. Then I'm taking his thumbs. He's not touching. For the little one, not touching. Okay, بعد انك بيكتب بس تمد رجلك مستقيمة. It's better to be done with a good exposure, looking for knee hyperextension bilaterally. This is I wouldn't say 3. This is a 3. This one is not hyperextending. بعد انك بيكتب مثل الأرض يديك زي ما هو. Okay, so his vital score is 3, so he's not hyperlax. مقترح. I would complete my examination by doing complete neurological examination. I will examine the cervical spine as well and the elbow. Thank you very much for your attention, and this is for the shoulder examination. النير تيست.